Senate. I wish to speak in support of the bipartisan compromise proposal before us today. A recent poll shows 61% of Mainers support expansion. We've heard personal stories. We've heard them today. They've emailed us. They've talked to us in the halls. For those of you not inclined to support expansion, I would ask why. If making people healthier and even saving lives is not compelling, then perhaps you'll be persuaded by the economics. Expanding MaineCare would inject $250 million into our state's economy. We will create jobs, estimated at more than 4,500, and increase desperately needed economic activity across the state. In addition, studies from both the Kaiser and Heritage Policy Center have confirmed that there are cost savings from the Medicaid expansion. They both project that Maine would save $690 million over the next 10 years. State Medicaid payments will decrease $570 million, and uncompensated care is reduced by $120 million. This later figure is significant because to make up for these uncompensated care costs, doctors and hospitals charge insurers more for the services provided to patients who do have health coverage. Insurers, in turn, charge higher health insurance premiums to consumers and businesses. This cost shift to premiums creates a hidden health tax. A Families USA report showed that the average insured family paid an additional $1,000 in premiums in 2008 to cover the cost of care for the uninsured. Business leaders across the country in Maine, New Hampshire, Kansas, Ohio, Missouri, Michigan, Colorado, to name a few, have endorsed expansion because they would like to stop bearing, in part, the cost of caring for the uninsured through higher health care premiums for their workers. Maine businesses compete with companies benefiting from this reduced burden across the country and around the world. To end, I would like to quote Governor Jan Brewer of Arizona, who signed a law to expand Medicaid in her state. She said this when announcing her support for Medicaid expansion in Arizona. With this move, we will secure a federal revenue stream to cover the costs of the uninsured, who already show up in our doctors' offices and emergency rooms. Weigh the evidence and do the math. With the realities facing us, taking advantage of this federal assistance is a strategic way to reduce Medicaid pressure on the state budget. We can prevent healthcare expenses from eroding core services such as education and public safety, and improve Arizona's ability to compete in the years ahead. Please vote in support of expanding health care coverage in Maine and help Maine to compete in the years ahead.